Good afternoon. We are from SMAN to Palangka Raya, and my name is Haruna and they are my partner, Diga Astrid and Fransisco We would like to present our invention. It's called Hisata Clayton Hyrosynthesis granasofolia, or we can call it ACHG. Ice cream herbal remedies invention from collaboration of Southeast Asian herbal flower and probiotic Lactobacillus bulgaricus. Before we go to our invention, we need to know what is a diabetes. Diabetes is a metabolic disorder characterized by high blood sugar levels or hyperglycemia. In 2019, there is 464 million people who suffer diabetes, and this number is estimated to increase to 578 million people, and in 2045 to 700 million people with increase of 51%. However, there's a treatment for diabetes. It's called OAD, or oral anti-diabetes, and it uses metformin. But metformin has common side effects, for instance, stomach cramps, diarrhea, and bloating. So we need to find another safer alternative to control our blood sugar levels in diabetes mellitus sufferers. Traditionally, many herbal medicines have been used to treat diabetes, some of which have proven their effect by scientific research both in vitro, in vivo, and in human clinical trials. So this is our product. There's a three type: ice cream cake, cone, and stick. For the ingredients, we use medical plants from Southeast Asian, such as rosella flower, blue pea flower, hibiscus flower, and globe amaranth, and red rose flower. All this flower is combined with a probiotic Lactobacillus bulgaricus. So, for the research objective, we need to find out the potential and compounds of ACHG to overcome hyperglycemia. Number 3, to find out the work mechanism of ACHG to inhibit alpha-glucose, polyol, AGEs, PKC, NFKB, and hexosomin. Number 4, to find out the work mechanism of ACHG to stabilize cis-A7, cis-B7, cis-A20, and cis-B19. And the last one is to find out the organoleptic test and potential of ACHG to be commercialized.
For our research method, we use a qualitative method that is intended to understand the phenomenon that research subjects experience. And the analysis was carried out by working with the data, organizing data, sorting it into manageable units, synthesizing it, looking for and finding pattern, finding what is important and what is learned, and deciding what to tell others. Meanwhile, the organoleptic test was conducted to determine the level of consumer preference, whether they like or not, for the color, taste, aroma, and texture of the ACHG produced. We used as many as 20 panelists and trained people, and each one of them was given 7 samples against 4 criteria that we already said before. This is our table, and this organoleptic test was designed using a descriptive experiment with swatch, composed of 1 feature as follows. At CHG1 until 5, we use 5 different South Asian flower with the same amount of percentage, but for the HCHG6 with only probiotic and corn pasta and stevia lips same amount, and the difference is in HCHG7 with collaboration of 5 Southeast Asian flowers and probiotic L. bulgaricus. Meanwhile, the test potential at CHG product preparation for commercialization on an industrial scale use the percentage descriptive method using interview and observation technique.
Used HCHG for potential commercialization test on our product to check if it has potential to be commercialized. And based on the graph, our product HCHG7 obtained the percentage of 85%. So it has the most potential to be commercialized. And these are our conclusions. Number 1, HCHG herbal ice cream remedies have the potential to treat hyperglycemia because empirical data showed that there's a significant reduction in glucose levels in the blood. Number 2, the active compounds found in herbal ice cream remedies HCHG are flavonoids and phenols. Number 3, herbal ice cream remedies HCHG inhibits the alpha-glucosidase enzyme at the brush border so that the breakdown of carbohydrates into glucose in the digestive tract is inhibited and blood glucose does not increase. Besides that, BBC is able to inhibit oxidative stress resulting in a decrease in various metabolic activities in the end, such as decreased activity of the polyol pathway, decreased production of glycation end products, protein kinase C, decreased activity of the nuclear transcription factor KB, and decreased activity of the hexamine pathway. These various metabolic processes will produce fewer reactive oxygen and nitrogen species. This situation will be reduced because there is a decrease in the free fatty acid levels and an increase in the production of antioxidant nitric oxide, so that it does not cause damage to the structure of the blood vessels. Number 4, the active compounds contained in herbal ice cream remedies, HCHG, such as flavonoids, can inhibit damage to pancreatic beta cells on Langerhans islands, which produce insulin and stimulate the release of insulin into the blood, so that it will have an impact on the structure of insulin consisting of A chains with 21 amino acids and B chains with 30 amino acids. Then the 2 chains will be stabilized connected by 2 disulfide bonds, namely between 4-cysteine A7 and cysteine B7, and cysteine A20 and cysteine B19, so that blood glucose levels will be controlled and reduce blood glucose levels. The organoleptic test results showed the best and consistent treatment is HCHG7 treatment. Number 5, the result of the potential commercialization test showed that the herbal ice cream remedies HCHG product had the potential to be commercialized by obtaining 85%. And these are our references. This is it for our presentation. Thank you for your attention.